Hi, good morning, everybody. My name is Dr. Gaurav Mishra. I am a child, adolescent, and adult psychiatrist and a health systems expert. I have more than 11 years' experience working in the county and the federally qualified health center space, building mental health and addiction medicine programs and integrating them into existing systems. This podcast is where I talk to people who have experience working in different areas of healthcare, from direct service delivery, administration, technology, entrepreneurship, and finance. They have thoughts on the problems in our existing health system and also solutions they have attempted. I find there's value in getting these ideas to a larger audience. And as we know, our ideas evolve as we gather experiences both in life and work. One of the ways I like to understand these ideas is to look at the life and career journey of my guests and how these experiences are actually helping them evolve their ideas. Hello, everybody. We are at the 4th episode of our Health System Fix podcast. I'm very excited today. I have a friend on, Rosalba Serrano Rivera, who's a licensed clinical social worker and the behavioral health director at Camarena Health in Madera, California. Thank you, Rosalba, for joining us. Rosalba has a deep commitment to advancing behavioral health equity and expanding access to care for historically underserved populations. She has extensive clinical experience working with children, adolescents, and adults. She has over 15 years of clinical and leadership experience. She provides strategic leadership, designing new programs, implementing trauma-informed care, which is culturally responsive and is also patient-centered. Her work emphasizes how important it is to develop a sustainable pipeline of clinicians who are bilingual and bicultural so that you can serve the community really well. She has been instrumental in advancing programs that integrate behavioral health into primary care and foster regional collaboration, addressing system barriers that, we're all very familiar with. Rosalba and I met at the California Healthcare Foundation's Healthcare Leadership Program. I was very lucky to be part of that cohort. So welcome. I'm so glad to have you on, Rosalba.
Hi, Gaurav. It's a pleasure being here with you this morning.
Thank you so much. I know you're busy and behavioral health, there's always work going on.
Mhm.
One of the ways I'd like to kind of talk to my guests and understand their journey is really starting early. So maybe if you can tell us a little bit about your childhood.
Yeah, for sure. It's a great start. So I'm a daughter of two Mexican immigrant parents. I was raised in a very small rural farm working town called Mendota. It's part of Fresno County in the Central Valley. So to give you a snapshot of Mendota, right? It's probably not even in the map. So growing up, I had a population of about 8,000 people. Now I think it has a population of maybe close to 13,000. About 98% identify as Hispanic, Latino. 30% of the population are below the poverty line. And then there's an unemployment rate of about 20%. And because it's a lot seasonal work and farm working, it's probably the main reason. So of course, the primary source of work is agriculture. In fact, Gaurav, every summer as a teenager and until I graduated high school, I would go work in the fields with my parents. So every year, there I was, me and my siblings, we would go. I have 3 older siblings. So we would all go work in the fields. So it wasn't unusual, in my town, right? Many students would go out and work in the fields, a lot of my friends, and really just kind of gather money for summer clothes. So growing up, we didn't have health insurance. So that meant we rarely went to see any doctor. Unless it was a complete emergency, then that meant we went to like an urgent care, maybe emergency room, because even like the nearest city is about 40 minutes away. Which was nice is that I was part of, I don't know if you heard of it, but it's called the Migrant Education Program. And so it's this like federally funded program. And it's really designed to support children and youth from like migrant farm workers so they don't fall behind academically. Sometimes with farm worker families move frequently or there's seasonal work or there's language barriers or other barriers. And so what was nice, I remember, is that they would have these like health clinics in the cafeteria, right in the middle school. So not a lot of privacy, but they were there and we would go and that's how I would get a physical exam. I don't think I really knew it was like an issue until I decided to go to college. So my parents instilled education in all of us pretty early. And so I'm the youngest. And so what that meant is that my siblings went on to college, what meant like I had to go. I didn't really have a choice. And so they're, I mean, great role models, right? I was able to follow in their footsteps. And so I went on to college. My mom was like, well, like you're going to go to college or you're going to work in the fields. And so like a lot of immigrant parents here in the Central Valley. And so I went on and pursued a degree in sociology at UC Riverside. I think growing up in Mendota and working in the fields allowed me to witness firsthand the resilience of immigrant and agricultural families, as well as the systemic barriers they face in accessing healthcare, education, mental health services. So these early experiences profoundly influence my commitment to advance like the equity and expanding behavioral health access for underserved communities.
And you said witness, right? But you actually lived it. I'm sure today when you see a kid who's living in a similar community, what does that mean to you as a person who's able to now provide care to that community? And what do you think that means to them that they are talking to somebody who has lived it, not just learned it in a book?
Gaurav, most of the clinicians I hire here are not only bilingual in Spanish, the primary language here, but also by culture. I had a teen and she had her 15th birthday and they celebrated and they made menudo. And so I don't know if you had menudo, right? But so she was talking to me, she was talking in Spanish and English and she's like, we cooked menudo. Do you know what that is? And she looked at me and I said, absolutely, and so it's so nice to be able to connect in like the culturally piece of it. And you can see it. And I hear these stories and over during supervision and with my clinicians, especially with teenagers, that they can come in and they can connect culturally and they can speak Spanish if they feel comfortable and they can go from Spanish to English all in one sentence and that they feel that connection and that they continue coming. And Madera looks very similar to where I grew up. That's one of the reasons I decided to stay in the Valley and stay with Camarena. Very similar population and farm working town. And so when we have these teenagers and they'll tell us sometimes they go work in the fields in the summers or they go follow the season, maybe to Oregon, and they come and they talk about it. And we also let them know, we're not disclosing too much, but like, hey, what are your plans like after high school? And have you thought of this? And or sometimes, they'll worry about the finances. Well, I got accepted to UC Berkeley or UCLA. I just don't know how I'm going to get there. And so really trying to empower the whole family as a unit. Like, hey, here are your resources. And like, can I connect you? So it's so nice we did the therapy piece of it. And then we wear all these different hats and did the social work piece of it too.
One of the concepts I heard about a year ago, which I love, we have so many clinicians and healthcare workers who are in communities. Maybe they didn't grow up there. They are served, but they are obviously still very passionate, want to serve. Is the concept of cultural humility versus the concept of cultural competence, which I think such sounds so different. That cultural competence, like going to a training for an hour, you're going to be competent in that new culture. That's just impossible. But cultural humility and curiosity is the right framework to think about it for people who are not from there.
Yes, absolutely. And I think that's the important piece, you mentioned earlier, Gaurav, like being able to experience it and like live it firsthand. And so being able to relate that way.
When you first decided to pursue your MSW and then you pursued your licensure to be an LCSW, what kind of work were you wanting to do?
When I graduated high school, I wasn't too sure what I wanted. I ended up taking a course in like sociology and I found it very interesting, the study of society and human behavior and social institutions. And then I would go home, every single time I was there, I was just reminded of the lack of resources, the high need and limited access of medical, not only medical, but behavioral health resources. And not only in Mendota, but the entire Central Valley. And so I ended up moving back home, ended up going to grad school. And then my second year, I interned at a FQHC. And my supervisor, Gaurav, who of course, was Elizabeth. And I fell in love. So she is so amazing. And I have no idea there was integrated behavioral health. when I thought of social work, I thought the therapy piece of the medical hospital, and then of course the CPS piece of it. And interning at the FQ where Elizabeth was, having her guiding me and supervising me to receive all the care, like this holistic approach it felt. And I was new. And so of course, I fell in love with it. At that time, they couldn't hire unlicensed clinicians. I ended up getting another job after I graduated, and it was really short, where I received a call and she said, "Hey, like, are you interested in an interview?" And we could hire unlicensed. And so absolutely right. It was the best learning experience I had, really, like at this FQ with Elizabeth, being one of my big mentors. I learned so much. I was there for about 6.5 years. I've always been pretty blessed to have really good leadership behind me. And so there is another director who actually connected me with our CEO here at Camarena. And they didn't have a behavioral health program. And it was starting from scratch, policies and procedures and hiring staff. I feel like I've always had a really good network, like guidance, and I was able to ask questions and an administration that like backed me up and supported and very innovative. And so I think like in the position now, it's been a journey of like growing into my position. Came in, but the administration piece was scary, like policies and procedures and what do we do here and the, legal and ethical piece of it. And developing a new behavioral health program was really educating not only our medical providers, but our entire staff on what we do. When I came in, people I think that were like, we're here for CPS. Like, oh yeah, you can call, I have something to report. Oh yeah, resources. I'm like, what? I treat patients and I can diagnose. And so I would go into like all the exam rooms. I would, knock and, hey, I'm Rosalba, and, introduce the BH program. And so it's been really nice. I've been here for 10.5 years now. Can you believe? I know, time just flies. And so it's been nice.
And obviously, I know Elizabeth, and she's a mentor for me right now in what I'm trying to do. It is so important that early in your clinical training, you find people who are so passionate, who are so determined, not just for the patient, but also thinking about the system. So just having that kind of exposure person around you, really helps shape you many different ways. What were some things that some of your mentors did, which were so different, and maybe you had not even thought about that? That, okay, this is also a way to be a healthcare professional. This is also a way to be a healthcare leader.
I think good mentors make a big difference. Something that stood out was that she was very supportive. If I ever had questions or like doing supervision, it's really scary when you're like going to grad school and really don't know anything about diagnoses or don't know a lot. And so just having that time to be able, if her, like she had, I remember, an open door policy, and I was able to go in and ask questions and being honest and transparent with me and or the whole entire team. And I really appreciated that, Krav. Like even here, allowing me to grow. So even going to the CHCF program, that took time and that's a commitment, allowing me like to work on these projects where maybe I don't know the answer, giving me that space. That's been important to me with any mentor I've had, but even my supervisors. And then being available and transparent. And yeah, sometimes it's hard being a leader. Like I think we're expected to have all the answers and we don't.
You definitely don't. Yes. That is going to be my next question. Like when you were first, where you mentioned that you were first asked to be a leader, or is that something you wanted?
I always wanted it. When I was at the other FQ, I ran this little grant program, and so, but I think that was my first experience in managing others. And so again, Elizabeth always kind of guiding me and providing the supervision. And so when I came here, I was first the manager and then the director. But I was always interested. And I totally agree, Rob. Because when you have great leaders and someone to look up to, I would look up to Elizabeth. I'm like, she's so great. Her skills and the way she talked to people and that empathy. And so like knew I wanted to be a director.
So when you have your first role as a leader, it is so different than what you think it is going to be like. So what is that first? I didn't think about this.
I think it's like the availability. Like, it's not like an 8 to 5 job. It's not. It is a round the clock, and it's being able to, work on boundaries. I'm still working on that. I'm a mom of 3. Then you add that to the mix, right? So adding, like, my personal and being the director and an administrative role and having people report to you and trying to honor when I have time off. That's hard. I still struggle with that.
Yeah, I think one of the things that I tell new leaders is for people to see you as a leader, the title is definitely not enough. It helps a little bit, but you have to solve your people's problems. I think you're reporting to your people who report to you. That's who your boss is.
Yes, that's true, Grab. Because I feel that humility piece of it too, staying grounded. I still see patients, Grab, and I feel like that honestly really grounds me though. Like, how else would I know the system, right? How else would I know like the day to day what's going on if I'm not practicing myself? And so I see patients and I know our EHR systems. If there's hiccups, I know that. If there's new workflows, I know that. And then I can present it with confidence.
Yeah, I think definitely it's so critical that a leader whose job is also to keep continuing to improve the system stays grounded. And I really think you give up clinical work for 6 months, you're not going to be as grounded as you were 6 months ago. It
Yeah.
doesn't even take longer than that. And as you said, when you design something new, you try to do something new for the team, you have to feel that pain yourself. The secondhand pain of hearing it from your team is not the same. And the team definitely respects a leader who's doing some clinical work and knows what it's really like to be on the front lines. And obviously that makes us better leaders.
So true, Rob. And then even like I have clinical measures too, right? And so showing the data back when I show them this data, I'm showing it on myself as well. And then we can problem solve together as a team.
Yeah. If you're a new leader, doing some clinical work yourself, and hopefully you're good at it. And so even the word spreads, patients talk, right? And people see you have empathy for the patients, you're really doing that work. So conscientiously people start hearing. So I think that is also a great way for a clinical leader to kind of, spend some time in doing that and but getting buy-in from the team.
It's true.
As you enter your leadership role, what specific steps to kind of grow your skill set as a leader? Because as we know, like clinical skill set, they help, but they are different skill sets, being a leader and being a clinician.
Yeah. I think the biggest growth for me was, of course, the HCF. I learned so much, right, on growing as a leader and my personality, right? And how do I really bring that to my team, our experiences? And so to me, that was a game changer and definitely recommend it to anybody else. And then there's like other courses that I do take like on an annual basis. And then to bring back, the team does the same and they think it would be beneficial to the team, they would do that. And Serrano provides like CEU monies, which is really nice, Groves. Not a lot of other places, but I think FQs do that really well. And so being able to keep up with everything because as a director, staff comes to you and you're expected to know the answer. And so, by keeping up, I think with these like mandated courses, I feel more confident in being able to provide that response for them.
Indian new leaders, staff coming to you constantly all the time can seem very overwhelming, but you should be happy they're coming to you. If they stop coming to you,
Be worried.
be worried. They're probably going to somebody else or looking for jobs. That's what they're doing.
Thank you. I didn't think of it that way, but that's
Yeah.
true.
Yeah. That means you're open enough
True.
for them to feel like they can communicate their problems. You may not always be able to solve them, but the fact that they can actually tell you is huge. And that, in fact, already improves the experience of work, just being able to share that with your leader. Let's talk about some of your passion projects that you've taken up at Camarena. Like one of those were building the clinician pipeline.
Yeah. So we partnered with different universities like Fresno State, or students will come intern. And then sometimes we hire them as behavioral health care navigators. And in the meantime, they get really interested and pursuing their master's. And so they'll pursue their master's in social work. They'll be with us the 2 years, typically interning during their master's. And what's really nice is that when they graduate, they can cross over as a clinician as soon as they get their associate number. And we've done that a few times. So this year alone, Grub, one of those students graduated in May and he onboarded recently. We had another staff member, her story's so neat. She started with Cameron as I think front support and then became a health educator. And then she became our like medical programs coordinator to our CMO. And then she decided to get her master's and she's now a clinician. So she's been here 10, 15 years around there. It's so nice to see her growth. And she's such a great clinician. They know Camarena, they know the population, they know our culture. And then I know them. And so being able to hire it is such a smooth process.
This is one of my favorite parts of community-based organizations. Most of the time, they have a lot more resilience and ability to invest in growth of their staff long term. But it's a lot of work. As leaders, we have to talk about financial sustainability. It's not always financial sustainable early. Can you talk about some concrete ways you invested in your team and you supported that growth?
Yeah. So we did have a grant for our behavioral health care navigators. And so we're able to sustain it. Or again, if our staff has been in other positions. And so it's easier when there's grant monies tied to it. And you see the value though in it. So it's like that retention. And we also have another grant that helps with the loan repayments. So finding incentives makes a big change to grow your own. We always say grow your own. So you see staff frequently moving between departments.
I think in leadership, you at times may have to think about your employee before you think about your program. It is counterintuitive. Sometimes people don't want people to progress, unfortunately, because now you have to find somebody else to do the work. But if you think about your employee and their growth trajectory, they are much more likely to stay in your organization much longer. And also that actually spreads the word about your organization wanting to help people grow in their careers. That attracts amazing people in the future.
Yeah, I'm pretty close to the university here, Fresno State. So I go out and speak to their MSW class as a guest speaker, and I tell them about integrated behavior health. It's been around for a while. Many people don't like fully understand it. A couple years ago, I went and I was a guest speaker, and we ended up interviewing one of the clinicians, and she said, "Oh, I remember you as a guest speaker," and she's a clinician now. But these like small communities, it's hard to hire licensed providers, and then you are like a Spanish speaker to that? Oh my goodness. And so it's super difficult to hire. And so being able to go out and speak to the universities on integrated behavior health, and then like they get it and like it makes sense.
Yeah, I think it's so critical to have that experience. Can you talk about an integrated behavioral health project that you led?
So we partnered with all our Madera County superintendents of schools. This is pre-COVID. Originally, it was intended for if there was a crisis, we would go in and help. And then COVID happened, and it was not intended like that anymore. There was so much need, and so our navigators was supposed to originally connect them and link them with resources. What they ended up doing was just really linking them to behavioral health services and if needed other services. And we like partner with these schools and we're pretty rural. And so if you've ever been to Yosemite, you probably passed some of these like cities where we have like Okers and they're super tiny. We're talking about Rob, no resources. And so these clinicians go out to the schools and a navigator who works like a case managers will go out at least 2 to 3 times a month where there's these super tiny schools, no resources. And so it's pretty neat. Because other than that, there's no way they would be able to receive services. Like the closest city is like 40 minutes away. Like transportation is limited. And so we're talking about a child on telehealth. That's so difficult. And so we experienced it during COVID. And so being able to bring that service over to them.
When I finished my training, took me a while to understand the impact navigators and community health workers have. I think what they do is they make it seem possible to the person. Whereas if you think this is the therapist, this is the doctor, I need to go get care, it may seem, especially in some of those communities where maybe Wi-Fi is not great either, or network is not great. And so actually knowing that, oh, this person knows that doctor, this person knows that therapist, they work with them. So they're actually like talking
Yeah.
the truth, right? It makes such a huge impact in somebody's life who may not have received enough or ongoing care ever.
Yeah. And you mentioned it, I said it so nicely, but like that care coordination piece of it, they have amazing skills. And we'll provide other trainings, but there's natural skills like these empathic skills and So resourceful. If they don't know it, they're like researching it, and I like so dependable, by the way. I can depend on them that they can provide the service, that they know the work, they know the clinician.
Right. So I was just thinking it is almost like transportation. You want to go from place A to B. You may love A, you may love B. Without a car, you can't get there. The navigators are almost like transporting that healthcare, actually making it possible, visible, reliable to patients that frankly clinicians they don't have time to do that. It's a lot of work. So it's great to have amazing community health workers, case managers, navigators on your team who can make that impact.
If I had that magic wand, I really wish we were able to be reimbursed for them. I just think it would make such a big difference if we're to receive reimbursement for everything they do.
In my view, the biggest gap in healthcare, and I think that's true all across healthcare, not just in mental health, is not being able to reimburse for those navigators because you can have all of the expertise, but without the hand holding that the patient needs in their moment of being vulnerable, they may not ever access care. You just have care available, but they don't have a way to access it. So that makes a big difference.
Yes. And they do so much. When we talk about like this access to behavioral health all over California, is they help with this. And so reimbursement would be nice.
What about some advice for anybody? Let's say this podcast ever reaches a teen who's listening and who's living in one of these communities, or even in urban communities, who's thinking about a career in care navigation or social work or being licensed. Would you have advice for them?
Yeah, having a mentor, like someone that guides you and you look up to. I'm a big believer at Grove that it takes a village for everything, right? It takes a village to raise kids. It takes a village at work. It takes a village like everywhere. Like there's no way we can do life alone. It is super hard. And so I think being able to have that guidance and a mentor that's been there and not being embarrassed, like reaching out and networking. I found that networking is so important. Like somebody knows somebody that knows somebody, especially as a like adolescent, like, oh, I don't want to ask that, or I'm embarrassed. And we're like, no, reach out and ask questions and research.
Okay. And advice for somebody, they've recently gotten their LCSW licensure. They're a strong clinician, they're passionate, and they think maybe in a couple of years, I want to be a leader. What advice would you give them?
I would say looking for the mentor, but looking for different programs like CHCF that really helps you grow. And then just making sure you're in a place where you feel you can grow. Because if you feel you come to like a stagnant, that's maybe like a signal to you. And so always like looking for growth opportunities.
Yeah. And one of the best things about CHCF was also knowing there are more people like you. I think I felt like an island thinking about the problems and trying to think about them differently and do them differently or try new things and fail. It was so quick to just feel at home in that group of people, which you were a part of, which is amazing.
And I think that's what it is, right? Like feeling that you're not alone, that we can like message each other. And it's made such a big difference.
Yeah, sometimes nobody knows the answer. That's comforting too, because then you can work on it
That's true.
together.
We're all doing it together.
Yeah. One thing you mentioned earlier was being uncomfortable. So one of the key pieces of, I think, growth for a leader, you have to keep putting yourself in spaces that you're uncomfortable in by choice, unfortunately. If you actually want that growth, you have to put yourself in that discomfort and to learn something.
That's so true. And another thing that CHC have taught is being uncomfortable. And so it's a project if it's being able to speak to all these people. I always feel like when you come out of that, I feel so empowered. And and then being able to take feedback, like that they're not necessarily criticizing me and my work, but it's this feedback, how I can improve it. And so I think that's super important. And that I've learned, like, hey, here's feedback. Let me give you this feedback. Or hey, have you noticed that? Or next time maybe try this. And so I appreciate that. I feel like that's how I've grown and grown.
One of the things I learned, leaders want feedback too from your team. And it is a difficult position for your team to always give feedback. One of the techniques I learned, which I actually tried in my last role, was to tell your team, they actually say these words: I give you permission to give me feedback or talk to me when you think I'm doing something that's not okay. And saying, yeah, please let me know if I'm not doing something right is not the same as saying, I give you permission to talk to me when I'm not doing something right. And
Mm.
a couple of people who gave me feedback later said, you actually said that, remember? Like, so I'm giving you feedback.
Oh, you're like,
Yes.
no, no.
That's it. Yeah, no, I actually meant it. So please, you do give me. It is actually such a powerful tool that you have a group of people. They, for them to do well, you also need to really perform well. If they can give you feedback and you're open to it, it makes such a huge difference. Makes you a better leader.
Every year we have this employee survey. And so I feel like it's for sure like an ego checker, right? Like, oh, okay, I might need to improve in this area. And kind of goes back to what you said earlier, that employees feel comfortable enough, right, to actually write it, right? Knowing that like that I'm gonna take that feedback. And so every year we go over everything that they that has improved or they would like to improvements or projects they would like as a team again to work on. And I've found it like pretty helpful. And so our medical providers do it with their CMO and I do it with behavioral health. And so it's been pretty cool to see. Maybe I thought something was working out and then I see it in the data and I'm like, okay, it's not working out, or something that I thought maybe wasn't, but it's working out. And so that's been neat. And I think it goes back to being able to receive it as well.
Last question I have for you today. What is the tough, difficult project you're working or exciting project you're working on right now that's you're pushing you to your limit and beyond?
Yeah. So my heart has always been like a maternal mental health. I enjoy maternal mental health and feel like it's paused. And so really trying to revamp that piece of it. Right now, like we have patients who come in to see behavioral health. We call them OB wellness visits, where patients come in and not necessarily because they've been referred, but almost like a, hey, let's check in. Let me tell you a little bit about postpartum depression, anxiety, and then other mental health disorders. It doesn't mean you're going to experience it. Let me tell you about it. So if anything occurs during your pregnancy or of course for postpartum, like here we are and here are the resources. And we see patients like pretty early on, like week 8, and maybe they've had like a miscarriage in between. And then we're able to touch them and see them and process and, their grief. And I would like to revamp that piece of it, like postpartum, like pamphlets or prior to COVID. We call them baby showers, where we kind of discuss postpartum health. And so then we pause it, and that's always been like my passion, maternal mental health, and it's so needed. And it still has like quite a stigma, just because after someone gives birth, they're expected to feel a certain way, and it's not always like that, or have this immediate connection with baby, and it's not always like that, and that's okay. And so being able to really normalize it, and so I'm always thinking about maternal mental health.
That's such a needed area of attention. We did some of that work at San Isidro, and I think dyadic care billing may also have a role in capturing some of that need, because oftentimes a lot of postpartum depression is diagnosed in pediatrics clinics and not in OB clinics, because moms will definitely go to the pediatrics follow-up. They may miss their own follow-up.
We're screening at our pediatric clinics because it's so true. Like we'll miss our appointment, right? Like who cares? But not babies. And so being able to capture and again, like educating everybody, like where do we refer if they score over a certain number on the screening? It's been so nice, especially to be able to give care. And again, we have a lot of Spanish speaking patients. So being able to give care in their language girl, is so huge to me. Patients who just migrated from another country, they're trying to figure out their OB care as well. And maybe they left their children. And so again, this adjustment, this grieving. And so a lot of different components.
I'll tell you, as a child psychiatrist, I've noticed, you know, more than 50% of my kid patients, and most of the time it's mom bringing them, more than 50% of moms have had untreated depression or anxiety of their own. And they could have been moms for 30 years and still untreated. They could have been moms for 2 years, they're untreated. And I oftentimes tell them it is so critical that part of that kid doing well is you're doing well, and like, please address your own mental health. And they feel it's their duty to take care of everybody else, and all the while they're ignoring their own health. Because hopefully there's less of that. Thank you so much, Rosalba. It's been amazing learning about your journey, learning about all the incredible projects you're working on. Maternal mental health is such an exciting project and so impactful. I wish you well in that project, and be uncomfortable a little bit as you figure it out. Good luck. Thanks so much for joining me today.
Thank you so much. It's been a pleasure being here.
Great.
Bye. Thank you.